This is the last of our video series over Chapter 37 in our Modern Dental Assisting book. In this portion of this chapter, we're going to talk about sedation and general anesthesia. We're going to start by talking about inhalation sedation. We have nitrous oxide oxygen. This is a combination of gases that are inhaled by the patient to help eliminate fear and aid in relaxation. It is non-addictive. The onset is easy, side effects are minimal, and the recovery is rapid. This produces the stage 1 anesthesia and dulls the perception of pain for the patient. Advantages include administration being simple and easy to manage, the service of an anesthesiologist or other special personnel isn't required. This has an excellent safety record. The side effects are minimal. The patient is awake. Recovery is rapid, and it can be used for patients of all ages. Disadvantages when using nitrous include patients sometimes becoming nausea or some vertigo symptoms, and patients who have behavioral problems may react in a negative way. This is going to be contraindicated for patients with COPD, cardiac diseases, pregnancy in the first trimester, upper respiratory infection, psychiatric disorders, middle ear disturbance, and critically ill patients. Equipment needed for nitrous include the cylinders, the nitrous machines, they're portable or part of a dental unit, the gas hose, and the masks. We're always going to review the patient's medical history before administering nitrous, and then we're going to obtain vital signs of blood pressure, pulse, and respiration before, during, and after. In patient education, we're going to describe the procedure of administering the gases. We'll describe the use of the mask and the importance of nasal breathing. We'll describe the sensations that the patient's going to experience, and we're going to reassure the patient. We're going to start with pure oxygen while establishing the patient's tidal volume. Slowly triturate the nitrous oxide until the desired results are achieved. The patient should refrain from talking or mouth breathing. The nitrous should end with administration of 100% oxygen for 3 to 5 minutes. We'll obtain post-operative vital signs and then compare them to the preoperative. The nitrous is going to only be used for patient treatment. We're going to reduce nitrous hazards to the dental personnel by using a scavenger system. Use a patient mask that's going to fit them well. We'll discourage the patient from talking and only breathing in and out of the nose. We'll vent gas outside the building. Routinely inspect the equipment to make sure we don't have any leaks in the hoses, and use a monitoring badge system to detect any nitrous. Next, we'll talk about anti-anxiety agents. These are sedatives. They're the drug of choice for physicians and dentists that are seeking to relieve anxiety in their patients. So we would use this when a patient is very nervous about a procedure is long or difficult, the patient is mentally challenged, or the patient is very young and requires extensive treatment. Next, we'll talk about IV sedation. This is an anti-anxiety drug administered by IV throughout a procedure at a slower pace, providing a deeper stage 1 anesthesia. Psychologic measures are recorded every 15 minutes. So we'll record the level of consciousness, respiratory function, ox, blood pressure, heart rate, and cardiac rhythm. General anesthesia is a controlled state of unconsciousness with a loss of perceptive reflexes that produces a stage 3 general anesthesia. It's a pharmacological makeup of a combination of gases, nitrous, halothane, and then IV agents. There are 4 stages of anesthesia. We have our stage 1, 2, 3, and 4. For patient preparation, we're going to give them preoperative physical exam or make sure that they've had one. Some laboratory tests may be set. and a signature of the patient or legal guardian on a consent form before the day of the operation. The dentist is going to review the procedure as well as the risks. The patient must not have anything to eat or drink 8 to 12 hours before undergoing general anesthesia. Once the procedure is complete, the patient is monitored closely until normal reflexes return, and the patient shouldn't be left alone while regaining their consciousness. Mind body medicine includes methods of reducing anxiety and pain through different non pharmacological techniques. These can include distraction, relaxation, so guided techniques, deep breathing, biofeedback, hypnosis, and acupuncture. The last thing we're going to talk about in this lecture is documenting. So, we're always going to want to document the following measures and observations. We're going to review the patient's medical history, preoperative and postoperative vital signs, the patient's tidal volume if inhalation sedation is being used, the times at which anesthesia began and ended, the peak concentration administered, postoperative time in minutes required for the recovery, and any adverse events the patient or patient complaints.